Hafa and good morning. The Committee on General Government Operations, Appropriations, and Housing convenes this public hearing. Public hearing notices were given to the media on Friday, May 24th, 2019. Second notice on Friday, May 31st, 2019. And for the record, today is Tuesday, June 4th, 2019. The time now is 2 minutes after 9 a.m. And the committee will hear and accept testimonies, both oral and written, on the referral of the appointment of Christopher A. Cruz for the member of the Guam Ethics Commission, as well as Bill 78-35 COR as introduced by Senator Therese Terlahi. And that is an act to amend Section 1 and 3, both of Chapter 3 of Public Law 34-116 relative to appropriating general fund revenues to local matching requirements for Medicaid. I'd like to thank Senator Therese Terlahi and acknowledge her presence here, as well as Senator Sabina for her presence as well. And I'd like to allow Senator Terlahi to go ahead and begin with an opening statement on her bill.
Thank you very much, Mr. Chair. Bill 78-35 addresses the $5.6 million shortfall that the Department of Public Health and Social Services was facing to pay Medicaid claims to private entities through the end of fiscal year 2019. In April 2019, Public Health reported that based on claims received, current processing, and the expenditure projections, it needed an additional $5.6 million for the local matching requirements and only had enough funding through the first week of April for regular Affordable Care Act Medicaid and Medicaid childless adults claims from private medical providers. The Medicaid program subsidizes healthcare costs for approximately 43,549 low-income individuals. Appropriating the $5.6 million for local matching requirements for the Medicaid program will allow public health to access an additional $6.8 million in Federal Affordable Care Act or ACA grant funds. The shortfall in Medicaid funding was first brought to my attention during a February 7, 2019 informational briefing with Public Health, and I introduced similar measures early on to try to address the need for funding. At that time, Public Health reported a potential $13.3 million shortfall. Since then, an executive order was signed by the governor to redirect $7.7 million of the FY 2019 GMHA pharmaceutical funds back to Public Health to pay GMH Medicaid claims, leaving a shortfall of approximately the $5.6 million. Still left untapped is approximately $61 million in federal ACA Medicaid funds that Public Health is unable to tap due to a lack of local matching funds. All federal ACA funds expire in September 2019. This year, Guam has already used $13.1 million of local funds to access $15.6 million of the ACA funds for Medicaid claims, according to the last update. Currently, we've all heard there's a bill in Congress, H.R. 2157, that would remove the local match requirement for Guam and would allow Guam to draw down from the available ACA funds without having to put up a local match, but only within a limited time frame of January 1 to September 30, 2019. The bill was passed in the Senate and is currently pending vote in the House. If that bill passes in Congress and is signed by the President, then this legislation may not be necessary for 2019. There is some optimism that it will pass in the House sometime this month, but Guam does not have any control of that vote, and we are waiting to see. I believe that one of our top priorities, pending any action by Congress, should be the health and wellness of our most vulnerable families who are eligible for Medicaid. There's an urgent need to invest in the local match requirement for Medicaid in this fiscal year to access federal grant funds to pay for Medicaid claims. Otherwise, the government is left to pay these claims or for these health care on its own. And if we do not prioritize this, we will lose the opportunity to tap into those federal ACA grant funds as they expire in 2019 forever. And many of our low-income families may not get the care that they need. I also want to point out that according to the March 2019 Consolidated Revenue and Expenditure Report, the government is collecting $6.4 million more than what was adopted in the FY19 Budget Act in the first 6 months of the fiscal year. The April 2019 report shows an even greater amount and continuing trend of collecting more than what was adopted. It shows that in the first 7 months of the fiscal year, $23.7 million more in revenues has been collected than what was adopted for FY 2019. Even if we subtract the additional child tax credits for April that are not accounted for in the CRER, it would still have a $10 million excess. Clearly, this situation needed to be addressed months ago, and today it continues to be a potential crisis. Public Health has exhausted its FY19 local Medicaid appropriation with 3 months left unfunded and $61 million in federal funds waiting to be tapped. The government cannot afford to cover these patients without the federal match, and our community cannot afford the risk of even a temporary shutdown in health services to these patients. The government must immediately allocate additional federal funds to public health through this bill or through the Governor's Transfer Authority or by redirecting other funds. I'm hoping we can clarify some of these issues at today's hearing, Mr. Chair, and I thank you for having the hearing on this bill.
Thank you, Senator Talahi. At this time, I'd like to call up Maria Archangel to testify on the measure. And anyone else who is here who would like to testify on this measure, you may approach the table.
Thank you. Good morning, Mr. Chairman, Senators. My name is Maria Teresa Archangel. I'm the Chief Administrator for the Division of Public Welfare, Department of Public Health and Social Services. With me is our Deputy Director and the Acting Director of Department of Public Health and Social Services. The Department of Public Health and Social Services supports Bill 13935, an act to amend Section 1 and 3, both of Chapter 3 of Public Law 34-116, relative to appropriating general fund revenues to local matching requirements for Medicaid. As you know, the Medicaid program provides medical assistance to the disadvantaged population on our island. The program expenditures continue to increase because of increasing drug costs, new treatment module, defensive medicine, growing and aging population, growing number of people with chronic diseases, and others. Last year's Medicaid program expenditure, that is fiscal year 2018, was $110.8 million. In comparison with fiscal year 2014, which is $8.3 million, there was an increase of 38%. Based on the program 5-year expenditure, the average expenditure increase was 9%. It should be noted that each year expenditure was controlled by budget law and or available local match and did not reflect the total yearly claims obligation of Medicaid. In fiscal year 2018, the local funding appropriation to match the federal grant award was $29.3 million. This fiscal year's budget appropriation is only $15.9, which is $13.3 million less than fiscal year 2018. Section 2005 of the Affordable Care Act provided $268,343,113 to Medicaid program. The remaining unreleased ACA funding is $47 million. This will expire on September 30, 2019. As per Senator Teresa Laje, if House of Congress approve the bill to increase the federal medical assistance percentage of Medicaid to 100%, then this $5.6 million is not necessary or will not be needed by the Medicaid program. To continue, very recently, GRMC submitted a total charge of 40.7 million Medicaid claims and 20.6 million MIP claims. So that equates to 61 million total charge of claims that was submitted by GRMC. And as a result of our meeting yesterday, they stated that they will submit 35 million more worth of claims to the program. Based on that, we have processed GRMC's claims to include all other providers' claims. Our total computable claims to be paid, which we have not transmitted to DOA as of May 31, 2019, is 24.5 million. Of that, GRMC is 20.3 million for GRMC. 20.3 million. That includes MIP. For Medicaid alone, it's 19.7 million. If you want. I only have 3. Yeah, that's a copy. So out of that processed claims, that will require 5 million already. The initial hearing that we had, we requested for 17.6 million. And so we were told to just assess it based on the claims processing trend and the claims that we have on hand. And that's why it was reduced to 5.6. That does not include the potential claims that we're going to receive. That amount was way back at the beginning of this year. So with that 5.6 million will only pay for the current claims, unpaid claims that we do have. So that means we would need an additional funding to last till the end of this fiscal year. Also, I would like to point out, I know this is for Medicaid, MIP program also needs additional funding because we utilize the MIP funding to match the MIP emergency services to avail of the Medicaid funding. Currently, claims received, we have 6 million for Medicaid that we have not processed and roughly 3 million under MIP to be processed. And so the 5.6 million additional appropriation will assist the program to pay the Medicaid unpaid processed claims that has not been transmitted to DOA. However, this is not enough to pay all the claims for the remaining of fiscal year 2019. But if House of Congress will pass that bill to utilize all the ACA by increasing the FMAP to 100%, then Medicaid would not need it. However, MIP will need that additional funding. Currently, we only have roughly 400 to 500,000 available funding to utilize under MIP. So we would request, we support the bill, we would request for the Department of Public Health to utilize that particular funding not only for Medicaid but also for MIP. Thank you.
Thank you. I'd like to call upon the Deputy Director, Acting Director of the Department of Public Health and Social Services, Ms. Lori Duenas.
Committee Chair Rogel and Senators, thank you for giving us the opportunity to come here and explain the situation with the Medicaid and MIP. Also in regards to the actual funding that's needed, and we are very much in support of this bill. If you look at the ramification, yesterday we had a meeting with the Department of Administration, and the question is always, how are we going to work with this so it doesn't happen year after year? The problem is that we did get Affordable Care Act money, and the other situation was we didn't have enough local funding to actually offset the funding, to get the federal funding. And so we're in that predicament right now. If the Affordable Care Act money is going to expire, we've asked for an extension. We're not sure if that will happen. The legislation right now is in limbo, and so it's all going to depend on whether they do approve the request that was made by the committee that went there. And so that's a huge concern also. Like Ms. Archangel stated, if they do approve the 100%, we're okay. But if they don't, then what are we going to do? Because the funding that is stated here is not even going to be sufficient. And so we'll have to come back again. And so I just wanted to make all of you aware of that. Thank you for having us here.
Thank you both for your testimony. And I'd like to open it up to our committee now to ask, and the panel to ask any questions, starting with Senator Talahi, if you have any questions.
Thank you very much, Mr. Chair. Thank you, Mary Tess, and thank you to the Acting Director, Laura Duenas. Thank you very much for being here and for your testimony. I want to, before I say anything other, to thank you also, Tess, for your testimony at Congress and for representing Guam back there very well. I'm glad that you were able to make an impression on them as to the need of Guam in regards to Medicaid, and I'm sure you had other meetings while you were back there too. So I want to thank you for all your work and for representing Guam very well. So if we could just clarify a couple things. First of all, so you've given us a sheet that shows unpaid processed claims as of May 2019, and for the processed yet unpaid claims, we could use the entire 5.6 million for our match of that. But you're estimating, or you already have received claims that would require an additional 6 million that are just not processed yet.
Sorry.
Oh, total.
6.7 and 6.7 million total charge. And at the same time, GRNC, during our meeting yesterday, they stated that they will submit 35 million more total charge.
Okay.
So that's not the
local.
total allowed. Yeah, and that's not the local.
What is the local liability that we're looking for? The 6 million and then for the 35 million from GRMC?
Roughly, we would require the same amount, 5.6 million also. The reason being is because there are different FMAP. It could be childless adult that will require 7% only. It could be 45%, depending on the claims that they're going to submit. So I won't be able to assess that at the moment because it has to be categorized.
All right. And then can you clarify again? So the bill, the disaster relief bill in Congress, as it looks right now, is proposing to increase the FMAP to 100%. And they say from January, right?
Yes.
Does that mean, how do you read that? Will we be reimbursed from what we've paid since January?
Yes, depending, I'm going to talk to CMS with regards to that, if we can do retro claiming. And so that local match that we use, it can be reimbursed if they agree, depending on the verbiage of the bill.
All right.
Or the
Yes.
law, if they pass it. Yeah.
And does the bill currently include the extension that you talked about, or is that a separate, something separate
No.
that you're working on? It's not in
No.
that bill right now, right?
No, it's not in that bill.
All right.
now.
So we're also asking the federal government for an extension to use the ACA money
Yes.
into next year. Otherwise, it's all cut off at September 2019, even with this disaster relief bill.
Yes. But there's still Section 1323, wherein there's 24.4 million that we can utilize on the first quarter of next fiscal year. That is, if we don't utilize it for this fiscal year, for
Right.
2019. No, depending on the claims that we do have, so we may or may not utilize that 24.4 million as a result of the health insurance exchange funding that was given to the Medicaid program.
Is that a available to us after we've exhausted the ACA
ACA.
funding, right?
Yes,
So that's,
yes.
that's the issue, is we have to...
Exhaust the ACA.
Yes. All
No,
right.
but basically, come September 30, I made an argument with CMS. Technically, the ACA is no longer available. So that means we can access that after that fiscal year, yeah, after 2019. And they said yes.
Oh, great. Okay, that's good. And the MIP amounts that you say, so you say you right now have 400 to 500 million available to you to spend for MIP for the rest of the fiscal year, and you're already looking at unprocessed claims of 3 million. Now this has no match. We are going to pay 3 million. Sorry, turn on the button again.
It's roughly 400 to 500,000. So definitely just St. Dominic's alone, that's not enough to last the end of the fiscal year. Yes.
So we have, sorry, I might have said it wrong, 400 to 500,000 available with claims that are unprocessed already at 3 million. Potentially higher?
Yes.
All right. Can I ask, is there a plan? What if we don't get the extension? Are you already planning for that? I'm assuming if we have no extra funding in these categories, that there's no set aside for next year.
Yeah. Yes. We met with CMS with regards to that. Basically, if the governor, based on the plan, definitely the government will be in big liability if we don't. 110 million is 110 million. That's the expenditure last year. So we'll be left with 18.3 million only for next fiscal year, plus the 24.4 million if we don't utilize it for this fiscal year. That's not enough. So we need to do something with with the program. It's either if we're allowed to decrease the income guideline, we can create the Guam Medicaid income guideline to just cover the children. Reduce the adults' income guideline. Initially, CMS stated no because of the modified adjusted gross income, but then again, they came back. They have an email. They said, yes, there's a flexibility to reduce the income guideline of the adult, but not the children, because we have cheap money up to 2027 that was reauthorized. And so the plan is to reduce the income guideline of Medicaid. Of course, if we reduce the income guideline of Medicaid, we have to reduce the income guideline of MIP, or else all of these clients will go to MIP, and that's still 100% local. Yeah, and then at the same time, we're going to remove some of the optional services like dental services for the adults, as well as prescription drugs. But what's the use of removing prescription drug? They can go to the clinic, the doctor can prescribe, but if they cannot, get the medication because they don't have money to pay, it's useless. Right?
Oh my goodness.
Yeah. So there are a lot of optional services, but those optional services like physical therapy, pulmonary inhalation therapy, we can remove that. But what will happen to the patient?
Yes, that is very concerning. So your proposal is to decrease the adult poverty level, or the eligibility. So less adults will be eligible. But we can then utilize the money for children. And you say we have enough demand for that?
Yes, because it's for this year, the local match needed is 8.5 only. But come next fiscal year, the local match will be 20%, and then after that, the local match will go back. It's 68.5. It's back 68.5 federal. Yeah.
All right. Thank you. Thank you, Mr. Chair. That's all my questions for now.
Thank you, Senator Talahi. Please forgive me, I forgot to also recognize the presence of Senator Telo Taidewi. Thank you for joining us today. And I'd like to allow Senator Sabina Perez the opportunity if you have any questions.
Just a question about the ACA funds. So I remember in the beginning of the year, we had about 60 million of untapped ACA funds. Is that correct?
61.
61 million. And then where are we at now?
47 million is unreleased, meaning we have not requested that. We have requested ACA funding, we have it, but just waiting for the local match. We asked for it in advance to release so that we can easily prepare the establishment of account so that we can pay the providers right away once the local funding is available. But we still have unmatched. Currently, that is already released by CMS.
Okay. So that's quite a progress there, you know,
Yes.
considering a couple months have passed. And I know we have a deadline up at September 30th. So, yeah, so it's great to see that you're working hard to make use of these funds, which
Yes.
is much needed in our community. So, yeah, I just don't have any further questions. Thank you.
I'd like to call up Mr. Ed Byrne from the Department of Administration, the Director of the Department of Administration, to please join us at the table.
Good morning.
Morning, Mr. Byrne. Please go ahead and proceed.
Well, I think I have a bit of news. That is my understanding that the legislation that would provide the 100% funding for Medicaid up to September 30th has just passed the House of Representatives. We're not certain about the wording because I just got a news flash, but that's certainly good news as far as Guam is concerned.
Right. Could you explain what that means?
Basically, it provides 100% matching, i.e. there's no need for local funds for Medicaid expenditures. But we have to look at the actual bill to determine when it starts and when it stops. But the intent was to provide total federal matching up for expenditures, and I think Tess will explain what expenditures mean, up to September 30th of this year. So we don't need any further matching local funds for that purpose, assuming that's what is intact in the bill. I think it's been sent to the President. The President, as you perhaps saw on television this morning, is enjoying the food that Buckingham Palace has to offer. So I'm sure as soon as he gets back, he will attend to signing this bill.
Okay, thanks. So we still haven't seen the exact wording, though, in the legislation. So assuming that it's intact as it was originally put in, then that's good news, correct?
Yeah, that's a good news. We're busy preparing for testimony, so we didn't check that one. Thank you.
Sure,
so
no
it
problem.
was just recently passed. But as I stated, the MIP program will require additional funding to last this fiscal year. So we would not, as it was passed, we would not need that once it's signed by the President. But then again, the MIP program will also need additional funding.
Okay,
Thank you so much.
thank you. Senator Tideway, you have some questions?
Thank you, Mr. Chair. And, you know, it's very complex, the process, not the process, but all the different programs and what is funded, the percentage-wise and stuff. It's very confusing, especially to the public trying to understand what you're saying. So coming in here, Mr. Burns, with the good news is great. So Tess, you did mention that MIP still needs to be funding, needs funding. How much additional? I'm sorry, the MIP.
To last to this up to the end of the fiscal year, it will probably need an additional 3 million.
Okay, and so, Mr. Burns, have you seen the fiscal note that came with this bill? Have you seen that?
Yes, I have, Senator.
Can you speak on it, please? Do you need a copy?
I think the gist of the fiscal note, and it's quite an important point, is that as far as the general fund is concerned, all the revenues have already been appropriated. And this bill, for however much we end up needing for MIP, assuming that we don't need any more for Medicaid, is an appropriation of funds that we haven't yet realized. And I think that was the issue with some other bills that came before you before. And I think we have the same issue here.
Okay, so basically what you're saying is that there is no funding for this bill.
The revenues have already been appropriated.
Appropriated,
Yes.
okay. Okay, no more questions, thank you.
Thank you.
Mr. Byrne, I have some questions with regards to your statement you just made with regards to the fiscal note. So can you explain that further? So essentially you're saying the revenues have all been appropriated, so there's no revenue or funding source for the measure. My understanding, though, is that the measure is based on taking a look at the projected surplus in collections. Is that correct? Can you explain how that all works?
Yes, and maybe I could also, if you would allow me to take a step back to what happened last year, because it was a kind of mirror image of what we're looking at. When the legislature passes the budget bill, the budget has to be balanced. So basically, as far as the general fund is concerned, all the revenues that are anticipated or forecast are effectively appropriated. If you can take a look at a forecast, but that's what it is. I mean, it's a forecast, and we're here in June, and anything can happen between June and September to affect that forecast. So I think that it's probably unsafe, especially for such a large sum of money, and I agree that it may become a smaller sum of money now, but for such a large sum of money to assume that that surplus is going to be realized. Last year we were in a similar position, and we had insufficient local match to pay Medicaid, and when the year had ended, BBMR were able to effectively patch together the appropriate funding in order that the bills that had been submitted could be paid, but they effectively patched together from whatever lapses were available. So you're not actually appropriating an anticipated revenue, you're effectively using a realized lapse in order to pay those bills.
Okay, thank you. Any further questions from Senator Talati? Good.
Thank you. Thank you, Mr. Byrne, for being here this morning. I appreciate your testimony. And congratulations on that great news. I hope it goes all the way through. Of course, wonderful news for Guam. Thank you for bringing that to us. I heard it just passed, so it's great. But back to the, will Congress, if that bill, would that cover tests, it says expenditures up until September 2019. Does that mean you have to hurry and process everything that you can get before September 2019, including the GRMC bills?
Yes.
And hopefully get those in before,
Yes.
not after?
Yeah, we're very much up to date on processing claims. That's
Great.
why it's only 6 million and 3
Thank
million.
you.
That can be done easily.
Thank you for that, and congratulations on that too, because I understand that was an issue before, but
Yes.
it's not an issue anymore. Thank you very much. What about, will the entire then ACA money go towards claims? There's nothing left for any of the other projects that were potential under ACA, is that correct?
Yes, I think it will all go. And if we're going to go retro, if they allow us, based on service date or received claims or processed claims, if we can go back up to January, then we can get that local match back. And so that 47 million of ACA will be gone right away.
And if you do that, will you be able to also access that other,
Yes,
yes?
24.4 million?
Yes.
Yes.
All right, great.
So what we have to worry is next fiscal year then.
Yes, absolutely. We will be in the hole all this money if we're going to cover healthcare for people. Otherwise, as you're proposing, we may not cover their healthcare at all. That's That's a disaster, I think.
Yes.
So, Mr. Byrne, you said the existing, that the legislature passed a balanced budget. We predicted revenues, and that existing revenues were already appropriated. Those are the revenues we predicted. And that it's, but what if the legislature's wrong in their revenue predictions? Where does that money go? For example, the report that we are receiving monthly from your office tells us that we were wrong, actually, and that revenues are higher than what we predicted last year, and we were very conservative in our revenue projections. And thankfully, the government is actually receiving a little bit more than what we predicted. So what happens in that case? Where does that money go?
Well, you could be wrong either way. It could be what you're referring to is a slight improvement over what was forecast, but it could be a deterioration by the time we get to the end of the year. That's just something that we have to deal with year in, year out. I mean, if it falls short of the forecast, then effectively we have some bills that we can't pay. If it exceeds the forecast, which I think is what you're really asking me, please remember that we still have a deficit on the general fund, and until we have a surplus on the general fund, any increase, any realized surplus over the forecast will effectively go to pay down that deficit.
All right. But there's a provision in law that says if we were wrong in our projection for revenue and it was actually too high, so we're actually receiving less, that we're going to go back and readjust the budget. And so I understand now we are projecting higher than what we predicted, and I was trying to say that the priority then should be Medicaid and not anything else, not the raises that we're hearing about in the newspapers every day, or not any other, what in comparison to healthcare I think is frivolous expenditure. So we want to control that and not be told at the end of the year, well, we spent it on these other things. And that's what my concern is, Mr. Byrne. And so I wanted to ask you about this. You said last year what happened because they were short in Medicaid appropriations or funding, that you patched together, that you and BBMR patched together some lapsed funds and used that. But lapsed funds, by what we went through with the autism bill, is determined after the fiscal year closes, isn't that right? And in this case, we were very much trying to get this money before the fiscal year closes because it's needed before September 2019. That's the whole point. We cannot wait for a determination of lapses. And I just think that if we're getting these reports, and they've been pretty consistent for the last 6 months, we're 6 months into a 12-month year, that it should be reliable. It's coming from, you, Department of Revenue and Taxation, and BBMR. I mean, input from it's based on actual receipts. And of course, we cannot plan for a disaster. A disaster might happen, but I think when we're looking at expiring federal funds and prioritizing those versus, look at what we're going to have to do next year. If we can't set this money aside, we're going to have to cover the entire bulk of it. Or if we can't get an extension. And I'm hoping still that they're going to be successful in getting an extension.
Well, Senator, I would always, in both the public sector and the private sector, be cautious about spending money before you actually receive it. And
But according to these reports, Mr. Byrne, it is received.
it's received, but it could
Of course, we could have a
suffer
disaster
setback.
tomorrow, and all of our revenue and every agency's appropriations would be gone.
I don't think it takes necessarily a disaster. It just takes a change of circumstance. It's not like, these are very small amounts,
Yes.
basically, in relation to the 1.3 billion budget as a whole. So, you
Small amounts of what?
I mean, they're
I
small
currently-
percentages. I just wish to, to
Be cautious.
make sure that everybody understands that I want to be cautious.
I understand. I'm estimating that they currently show $13.3 million. Oh, no, sorry. It shows, for April, it was showing 23.7 million in revenues. Wait. Yeah, 23.7 over and above what was predicted. And if you take away, as the fiscal note suggests, the additional child tax credits, that would still leave approximately $10 million. Is that correct?
Yes, but by way of caution, and I think in the CRAR for April, there's a prediction of a shortfall in the Healthy Futures Fund. So where is that shortfall going to be found? And it's going to be found in the general fund. So please, I encourage everybody to look at the full picture. And that's an example of, where a circumstance that just might turn that very small surplus. It might have to be used to make up for the deficit in the Healthy Futures Fund. I know it's a kind of reversal of fortune for the general fund to have to make up for special funds, but that might well be the circumstance this year.
That's very interesting, because the autism bill that was supposed to be appropriated out of the general fund, you told us to instead go and take it out of the Healthy Futures Fund. But I'm looking for the Healthy Futures Fund on this CRER report. Is it on here?
There's a different report for the special funds.
Yeah, it's not on this CRER
Right.
report.
But in may I just point, in computing that deficit, the amount that's going to go to the Autism Centre is obviously taken account.
Are you able to transfer money to public health to cover the Medicaid or MIP without an additional appropriation to cover their needs for till the end of the fiscal year?
Like I mentioned, hopefully it's just MIP that we have to take account of. If we run out of appropriations, then we have to, in association with BBMR, we have to find those appropriations to make. And that's what, that was what I was describing happened last year, is that the lapse funds amounted to a way of appropriating those funds.
Tess, the shortfall, $3 million for MIP, has that been appropriated to you or not?
No.
It hasn't been appropriated, Mr. Burns, so my question is, do you need an appropriation to cover the $3.3 million additional MIP liability, or are you just going to transfer that money over to them to take care of the MIP liability?
We have to pay the bills, whether there's an appropriation or not. So that's why last year we ended up by finding those funds in those lapses.
Is it possible that then, if you don't need an appropriation, that you are spending our increased revenues on whatever you decide, as opposed to what the legislature has decided it should be spent on? For example, if the legislature did not make this appropriation to MIP for $3 million, and you are allowed to pay the MIP for $3 million, then I think that's what I'm concerned about. And of course, the example of MIP is not concerning at all. We're celebrating that you are able to transfer that money over there right now and take care of that liability. But what if someone else in your position takes that money and transfers it for raises in some other agency, for example, or to cover expenses that were not even talked about when we passed the budget. Like, we budgeted based on no deputy directors, things like that. So we know that this money is now being spent on all those things, and yet we have not yet appropriated what public health might need for MIP, what they needed back, a few months ago and depending on what Trump does, President Trump does, might still need for Medicaid.
Well, as I said a few minutes ago, in a deficit situation, there will always be bills that have to be met with whatever funds come in. The deficit I think was the end of 2017 was 73 million. So whatever money comes in, and until that deficit has been eliminated, and it can only be eliminated by having those revenues and surplus revenues to exceed those, to pay down those liabilities. Until that happens, there will always be a need for those funds.
So
How you, if I may, how you emphasize, I mean, I understand that your desire is to emphasize the need to pay the MIP, but in the financial statements, that's just a bill like any other. Whether it's a bill for, a rent bill, this happens to be an MIP bill. We have to, if we've incurred the cost, we have to include that. And if we can't pay it, then it just increases the deficit.
Yes, but we're trying to control our costs, and we can't control MIP costs. Those we want to cover as a government, right? There are other costs that we can control. And so what the legislature tries to do in its role of appropriating money is to control that we can pay MIP, even if we have to give up paying salary raises or give up paying for deputy directors. There were so many provisions in the budget to cut costs, and I'm just saying then that if we've cut costs and we are experiencing enough money to cover the MIP, then that should be our priority, and not allow that money to be at the discretion of anyone else. It should.
We have. We've had some discussion yesterday about how we might control MIP because you're right. It's one of the MIP and Medicaid, and we may have to deal with the Medicaid issue again next year. Is a cost that comes through without a purchase order. We don't know what the cost is going to be until it happens.
That's my question to you then, since you've said today that you can pay these MIP, $3 million extra, without an appropriation, then for FY20, let's say the legislature does not appropriate anything for MIP, are you going to cover that as well? And we can then dedicate that money towards increases in every other agency, Guam Behavioral Health and every other agency. We can put that on the books if we don't need to put everything on the books.
Well, I hope we don't, take these. That's an extreme position, Senator.
I hope so too, Mr. Byrne, but that's an example that I'm trying to show you the logic of what you're telling us, that we don't need an appropriation, and that appropriating our excess general fund money right now is unsafe, as opposed to leaving it to the discretion of everybody else to spend, as opposed to directing it to where it's really, where we as a legislature determine it's the priority.
Well, respectfully, you're dealing with two estimates, an estimate of revenues and an estimate of costs. Both of them could be wrong, both of them could be right. So, I think that what I was trying to say is, as we go through the year, and we get closer to the end of the year, then we would know what available funds are available from these lapses. And these lapses in the past have always been we were able to pay the bills. I mean, I assure you it's not very comfortable for the people that work at DOA, because they're constantly getting calls saying, when are you going to pay our bills?
Yes.
And it takes up a lot of their time.
I understand.
But we deal with it.
Can I ask you something then? When we first talked about this and Medicaid, the need, It was estimated at that time that the funds would run out in April. And that was one of the reasons why it was an urgent matter. And that's another thing. I agree, it would be great if we could all wait until closer to the end of the fiscal year to kind of, account for everything. But we're 6 months into the year, and I just thought it is the time. Actually, at that point, it was only 4 or 2 months, and we already knew we were short, right? We were going to be very, very short. Starting April, not paying those Medicaid bills, that's what, we get other repercussions from those and they're very direct repercussions on health care. That's the problem. We are trying to prevent those further repercussions on our healthcare system. We've got foster children saying they don't want CHIP insurance. They only want, private insurance because some doctors will not take CHIP insurance, or they will not accept patients who are paying with CHIP. They only want patients who are paying private. So you see, there are other repercussions that I think public health has in mind, and we're just trying to prioritize where this, if, and I know you're trying to be safe, and I would like to be safe too. That's exactly what I'm trying to do. If there are excess revenues over what we predicted last year, I would like them to go to Medicaid or MIP and not go towards increased salaries or increased expenditures that were not anticipated when we passed that very frugal budget last year, I thought. Again, may I ask then, when there was an additional, for the autism bill that we passed, it said the appropriation was for general fund, and then later on, the governor sent a bill suggesting that money come out of the Healthy Futures Fund. Are there other special funds where money is available right now that are available to be expended, such as was recommended with the Healthy Futures Fund?
Well, as we've experienced over the last year, these special funds all have special purposes.
Yes.
So I think I would be loath to suggest that we should use a special fund for a purpose that it wasn't intended, because that's kind of what was not enjoyed over the past 2 years.
But still they require appropriations, right, out of the special funds, even for their intended purposes sometimes.
Yes.
Right.
Yes.
So that's what I'm asking. Are there any special fund balances that are looking good that were not, or left over from prior fiscal years? For example, the autism money is now going to come out of FY17. That's what it looks like. Is there any other money like that from special funds that should be appropriated to these agencies for their intended purposes?
Yes, there probably are, but I don't have them in my head. But most of the special funds are the intention is that the agencies that benefit from them are supposed to nominate what appropriations should be made.
Yes.
And it's up, like the 911 fund, it's up to the Guam Fire Department to determine how that should be used. And
right.
I'm going to leave it to those agency directors, because if DOA tries to interfere with that was what caused the problem in the past.
But Mr. Byrne, you just said it requires an appropriation. So we're trying to get
Yes.
to what action is needed by the legislature in order to utilize these funds for their intended purposes. And even for their intended purposes, we've agreed many of these funds still require an appropriation, that language, that bill to be passed by the legislature.
Yes.
Right.
And please, I'm suggesting that you speak with the agency directors that are responsible for those funds.
Yes, well, I would just like to ask you if there are balances, because we're halfway into the fiscal year, and some of these agencies were very frugally funded, and if they could use those funds, for example, the Department of Land Management's, I think it was their survey revolving fund, or one of their funds was also rated for use by the government of Guam, and they've not been reimbursed those funds either, which are for a very particular use. So, thank you, Mr. Chair. Thank you, Mr. Byrne. Thank you, Tess. Thank you, Ms. Duenas.
Thank you, Senator Talahi. Senator Titagui.
Yes, thank you, Mr. Chair, for the another opportunity. Mr. Burns, I appreciate how you're being very financially responsible and ensuring that things are being paid out, and if not, that there is some kind of contingency at the end, which we know in at least the 8 years I've been at the administration, it's never been that way, really. There's always funding, there's always, like you said, debt service that we have to pay, et cetera. But my question now would be on tax refunds. I know it's a little bit out, but even with all these, if there's any funding that are coming into the government of Guam that in excess, this would also have to attribute to additional tax refund payments. Is that correct?
Well, the revenues that have come in are primarily tax revenues.
Right.
Some of those tax revenues that have been paid will eventually be paid out as tax refunds.
How are we doing as far as paying out our tax refunds?
I think the governor said yesterday in her address that we're pretty much in line with previous years in the pace of refunds.
Okay, but I always hear that toward the end, the end of the fiscal year, we're still having to pay the prior year tax refunds out, and usually that you talk about utilizing funds to pay that as well.
Yes, and she made reference to that yesterday too.
Okay.
In that this year we had to pay out some prior refunds. That was principally because those returns, they have to be A status, which I understand to be returns that are complete in all respects, and some of what the returns that were filed in previous years and last year were incomplete. When those are corrected, then they become available for refunds, and that's what has to be paid out first.
And that's usually anticipated every year at the end of the fiscal year?
Yes. Yeah.
Now, the governor has a transfer authority, correct? Still has that transfer authority? And
yes.
When you talk about where BBMR and DOA got together to adjust some of that payment, the governor can actually use her transfer authority to pay MIP at the end of the year. Is that correct?
Yes.
Okay.
That's
and that's
correct.
usually what happens.
Yes, and that was what I was referring to.
And that's usually at the end of the year where it's being more responsible as far as what is really there, a reality of money.
Yes, last year, we had a fair amount of disruption in our cash receipts.
And in your professional opinion, that's the best route to go, is to wait and to actually see the actual money.
Were we here 5 years' time and we really had a dependable trend on what the new pattern of cash receipts are, having taken account of the Tax Cuts and Jobs Act, that might be different. But really, we're only in the first year.
Right.
And it, my recommendation is that always be cautious.
Okay. Tess, last year, the FY19 budget, how much was appropriated for MIP? Oh, sorry.
For MIP, roughly, I think 15 million.
I'm sorry, say again?
15 for last year.
50?
15.
Oh, 15
roughly
million?
15 million,
Okay.
yeah, roughly 15.
And what was that was FY19, this budget, this year?
FY19, I think they reduced it by 1 million, yeah.
So FY18 was 15 million, FY19 was
Yeah,
14 million.
If I'm not mistaken.
Okay.
Yes.
And this year, the FY20 budget,
did not put it
what have you requested for on MIP? FY20 budget?
Yeah, actually, the proposed budget that we submitted, we were told to cut, so
Okay.
we have to cut. So that's only, the request in there is only 300 some.
What? No, FY20 budget, the proposed request for next year?
Because we were told to cut. The reason being is because instead of using it under MIP, we have to use it under Medicaid. So we were told to cut roughly 11 to 13 million, so we have to cut. Budget ceiling. because of budget ceiling.
Okay, so that amount again, Tess, for FY20 for MIP again is how much? $300,000?
$300,000 is what we put on the budget. But of course, the governor has a transfer authority. If there are available funding, then that will be given to MIP.
Now that-
And if the Medicaid program, if they increase the FMAP and remove the cap, then definitely there will be an additional funding for MIP, which the governor can transfer from Medicaid local match to MIP.
How do you
That is contingent to...
That is the plan, right?
That
Tess?
was the plan.
That's the
Of course,
plan
we
for
always
FY
have a plan.
Okay, that's
yeah,
that's
that
'cause-
is if they're going to pass.
Okay.
Yeah.
That's if we're going to
No, I mean, this
pass
is different.
plan.
The reason
Okay.
why we testify also is to increase the MAP, the FMAP, as well as to remove the cap of Medicaid. Yeah, if that doesn't happen, both MIP and Medicaid there will be not enough money for both programs.
Okay. Well, that's a huge, Mr. Chair, that's a huge difference from 14 million down to 300,000 for FY20. So, okay, well, I appreciate your answers and appreciate you being here. And Tess, I'll be probably meeting with you later on today. So,
Okay. not a
thank you so
problem.
much.
Thank you, Senator Taidui. Allow me to recognize the presence of Senator Jim Moylan as well. Senator Moylan, thank you for joining us. Are there any questions you have for the panel? All right, if there is anyone else who has not yet testified who... Sure, Senator Talahi?
Mr. Byrne, what are you estimating, what are you tracking to be the shortfall in the Healthy Futures Fund for FY19?
Well, respectfully, it's not me that does the tracking, it's BBMR. But I think it was, you're talking about revenues, the shortfall in revenues of, I think it was like 3.4 million.
3 million?
Yeah.
Yeah, but you're currently tracking on the CRER, it says you're tracking 37 more million than what we estimated, and that you're currently collecting 23 more million.
No, I don't.
Well,
I
currently
don't
says-
recognize those figures, Senator.
Well, 23 million, we talked about that earlier, 23.7, and you confirmed that that's correct, and that if we reduced it by the child tax credits, as was suggested in the BBMR's fiscal note, that would still leave about 10 million.
Yeah, that
But-
figure didn't come from me. I think it came from Tess, but
No.
I didn't confirm 27 million.
Oh, so,
right.
well, I got that from the CRER, April 2019. So what
Yes.
are you looking at?
I don't recall what the number is.
No, the CRER.
Yes, I don't recall what the number says on the CRER, but if you're looking at it, that comes from BBMR. If it's as far as the general fund is concerned, then well, it happened to be my deputy because I was away, confirmed those numbers. So whatever the number says on there,
Yeah, 23.7 million.
that's what the
Those-
CRER confirms.
Those are actual receipts in excess of projected revenues. And you're tracking 37 million to be received at the end of the year in excess of projected revenues. So I just wanted to clarify that. So, and now you're saying we have to hold off because of the Healthy Futures, what you're saying may be looking at a $3 million shortfall?
Well, I wasn't saying exactly that. I was saying that would be an example of a trend in the opposite direction, and we need to be careful of favorable trends and wary of unfavorable trends.
Yes, all right. Thank you, Mr. Byrne. Thank you, Mr. Chair.
Right.
I'm sorry, let me just add. All right, well, thank you. Thank you all again.
All right, if there's anyone else who has not testified, who wishes to testify on Bill 78-35 COR, if there is no one else who wishes to testify, thank you very much for your testimony this morning. At this time, I'd like to take a 5-minute break, and then we'll proceed after that with the appointment of Christopher Cruz. All right, welcome back. I'd like to continue now the other portion of the hearing with the appointment of Christopher Cruz. Mr. Cruz, please join us at the front, as well as anyone who's come here to testify on Mr. Cruz's appointment. I believe some of the names we have signed up here include Patricia Salas, Isa Koki, Francis Cruz, and Ana Alicia Cruz. So if anyone would like to provide oral testimony, please join us at the front. All right, let's begin now with Ms. Koki.
Hafaday, Senator Rajel, Senator Talahi, good morning. My name is Issa Marie Cruz Koki, and I am here in support of Christopher A. Cruz's nomination to serve on the Guam Ethics Commission. I have known Chris my whole life, as he is my first cousin. We grew up more as siblings than anything else, as we are both only children. We attended the same elementary and middle school. We were watched by our grandparents every day after school. And in our adult years, we found ourselves working for the same employer at Bank of Guam. As the eldest grandchild of Jose and Dolores Cruz, he served as a positive role model to me, as well as to all my cousins. He is intelligent, passionate, highly analytical, and strong-willed. I've always known him as someone that does the right thing and is thorough when making decisions. He upholds the values of respect, honesty, and integrity. He doesn't back down from a fight when he is fighting for something he believes is right and just. Chris is currently a relationship banking manager at Bank of Guam. In his position, he takes care of some of the bank's most important customers. This role requires him to uphold high ethical standards, as there are many opportunities for unethical behavior to occur. Expensive gifts can be exchanged for loan approvals, personal bribes for better fees or rates, non-business expenses classified or hidden as business-related. However, Chris has been able to flourish in this role due to his impressive portfolio and relationship skills that are both fair and profitable. He upholds the highest professional integrity, and his moral compass is intact. Prior to being a relationship banking manager, he was a branch manager in Pohnpei, where he was adored by the community because he took care not only of the business needs, but of the people. He was a vested member of the community and showed compassion for the people and their island. Chris is also an active member in our community. He is a member of the Rotary E-Club of Pago Bay and an active parishioner of Our Lady of Peace and Safe Journey Church in Chalampago, where he serves as a lector, a Eucharistic minister, and the fundraising chair of our parish council. He is a devoted husband, father, and son. He values family and his faith. I have known Chris to always been one to rise to the challenge, and I'm certain he welcomes the opportunity to serve the people of Guam with arms wide open. He is a good fit for this commission. He will bring with him his experience of sound analytics and thorough decision-making, and his principles of integrity and honesty. Thank you for your time.
Thank you, Ms. Koki. Mr. Cruz?
Thank you, Hafaday, and good morning, Senator Clint Rajel and Senator Therese Salai. Thank you for having me this morning. Again, my name is Christopher Cruz, and I'm happily married to Ana Alicia, and proud father to Ariana, who is 11, and Christopher II, who is 8. Together, Ana Alicia and I raised our family in the beautiful village of Chalampago. I'm a friar, having finished at FD in 2002. I'm also a Triton, having earned my Bachelor of Arts degree in Political Science in the fall of 2006 from the University of Guam. Currently, I am a relationship banking manager with the Bank of Guam, where I've worked since July 2nd, 2007. I started as a management trainee, worked in different departments throughout the bank during this one-year program, and was promoted to loan officer with the bank's Upper Tumon branch. I worked in Upper Tumon for 4 years before going back to school and earning my professional Master of Business Administration from the University of Guam in 2012. I then took the plunge, as Issa had mentioned, and moved to Pohnpei, where I ran our branch from 2012 to 2014. This was the best career move I've ever made to date. Working in Ponape not only exposed me to different, more demanding work environment, but it also opened my eyes to the beauty and purity of an island environment so lush and to a people so true to their culture, things that I used to take for granted living here on Guam. As a relationship banking manager, I tell my people my job is simple. It's to keep my customers happy. Sometimes this is easier said than done, especially in the competitive and ever-regulated world of banking and lending. I work predominantly on the commercial lending side of banking, but as mentioned earlier, I have experience in branch operations as well. As a lender, I understand how critical following the rules and doing the right things really are in this business. In fact, my motto has always been, get the job done right the first time. I have had and continue to take advantage of opportunities to grow professionally through the bank. I am, however, motivated and energized to continue to serve as a Rotarian with the Rotary E-Club of Pago Bay, Guam, and as a member of my parish council in Our Lady of Peace and Safe Journey Church in Chalampago, and of course now being considered to be a member of the Guam Ethics Commission. I'm a firm believer that government should stay accountable and open to the people it is empowered by. In my capacity as a banker, I have lived accountability and transparency, not only to my customers and fellow coworkers, but to my shareholders and the communities that I serve. I believe I am the same way with my family and those around me. I am pleased to be here and to be considered by you and the committee, members of our legislature. Si Diyos masi.
Thank you, Mr. Cruz, for your testimony. Senator Talai, you have any questions for the panel?
Thank you for your testimony, Isa, and thank you, Mr. Cruz. I appreciate your testimony also and your acceptance of this nomination. Isa, can I just ask, did I hear you correctly that you said he was highly unpolitical? What did you say about political?
I did not. I believe I said highly ethical.
Oh, highly ethical. Okay, I was like, oh, I've never heard that. I want to know what that means. Okay, great. Highly ethical, great. And then, so Mr. Cruz, yes, I appreciate your experience and especially what you said about Ponape. I think Brandon will be happy to hear that. He's still there, right?
Yes, actually, Brandon Cruz?
Yes.
Yeah, he's in Kashrai right now.
Oh, he's in Kashrai.
Yes,
All right.
Yes.
Well, great.
Yes, but
Well,
we work closely together.
Well, I also appreciate Isa's testimony pointing out how opportunity for corruption and other transgressions are available in your work, and that she believes you're very resistant to those types of things and a good fit for this board. My only concern, I guess, is that we're a very small community. For the past few years, nobody wants to serve on this board because, of that. You're kind of having to be the judge and jury over friends. These are going to be your friends. These are going to be your acquaintances. These might even be your business associates. And you're going to have to do it notwithstanding all of that. And I guess I want to just hear it from you. Are you able to do that? Do you feel like you're going to be able to resist this, it's embarrassing to criticize your friends sometimes, and of course it interrupts relationships, but I'm afraid that's what this board demands of you. Are you able to do that?
Thank you, Senator Terlahi. When the governor approached me and she asked me, whether I would consider, I just straight away told her that I would, and I understand after talking with several people, and people are looking at me like, wow, you're about to go on another full-time job. And I said, in my mind, I was like, okay, I'm up for the challenge. In short, I'm going to bring my experience as a lender to be fair and impartial to what I do on this board, if accepted. I do it day in and day out. In my career, I have to make decisions even maybe not for my family, my close family, for example, but at the end of the day, I have to be able, I have to be the one to respond to them when they ask, for loans or anything on the banking side of things, right? And I always come back to, again, my policies, always come back to my underwriting experience. I really ultimately keep the best interest of the bank and of the customers well at hand, and I think that I bring that to the table here. And this is definitely, I mean, you know, being, like you said, a judge and jury, for example, for cases of dishonesty or unethical behavior brought, you know, to us by public servants or even elected officials, you know, I think that I will be able to maintain that level of impartiality and to be able to respond accordingly.
Appreciate that. Thank you, Mr. Cruz. Thank you, Mr. Chair.
Thank you, Senator Talahi. And thank you to both of you for your testimony today. Congratulations, Mr. Cruz, on your appointment. I appreciate the testimony from both of you with regards to specifically tying in how your experience at the Bank of Guam has helped shape your and provide evidence as to your ethics, especially with regards to Ms. Koki mentioning how you're in a position where people may offer you things in order to get their loans approved, et cetera. And she's testified saying that she believes that you are not the type to accept any gifts of that nature that may influence your decision making. So I hope you continue in that vein, and encourage you to do your best and make the right decisions for everyone if you are confirmed. But I will let you know that from what I've heard so far, I think you have my support for your confirmation at this point. So I want to thank you for that, and ask anyone else here, if there's anyone else who's here to testify on your behalf, please come forward. If not, we will go ahead and end this hearing. So the committee concludes the public hearing for the appointment of Christopher A. Cruz to the Guam Ethics Commission. The committee will continue to receive testimonies for the next few days. Please address your written testimony to the Committee on Government Operations, Appropriations, and Housing, and submit it via email to Senator Joe S. Agustin at gmail.com. His office is located at the RAN Care Building, second floor, Suite 3761, South Marine Corps Drive, Tamuning, Guam. Thank you all for your participation for today's hearing. For those of you listening at home, I am filling in for Senator Agustin as the Vice Chair of this committee. Thank you.